This is our automatic flexion table called the AFT table. It has standard features: a tilting headpiece, elevates positive and negative, has the gripper bar for the patient to hold on to, which slides in and out. They can control that themselves. It has a thoracic release, which could also elevate up, and has the ankle straps, Velcro ankle straps, with a slide out foot section. The AFT table is also an elevation table with a rocker foot pedal mounted to the base that you can operate it on either side. The AFT table also has the capability of adding drops. We have a pelvic drop. You push down on the cocking handle. A thoracic drop. And a cervical drop. This is our cocking lever for our cervical drop. It's a forward motion headpiece. If you want to change it to a straight down drop, you can pull out the little lever, cock the drop up. This will go straight down. To get it back into forward motion, make sure it goes in the groove, cock it up again, and that's your forward motion. All your tension knobs are located on the front side of the table. This is our control panel. We have a horizontal on and off switch. If the switch is left on position and you start the table, and at the end of the treatment you turn it off, it'll come back to a horizontal position. If you put it in the off position and start the table, you can inadvertently stop it at any location. This is your speed control, which we could go down to 1 revolution per minute or up to 28 revolutions per minute. This is the patient control switch that if you select it in horizontal, the patient can turn it off and the table will stop in horizontal position. This switch is usually used for when you're doing drops. You always want to make sure the table is in a flat position. You put it on horizontal and stop it. When you're entering and getting off the table, you would want to put it in the off position, start it, stop it here so the patient can enter onto the table or get off the table. Notice as the table's moving and we elevate the table up or down, it doesn't change the function of the lower part of the table. It's always going to move the same rate. We have a locking device located here for lateral motion. We can unlock it and insert a tiller bar and use this for lateral motion, circumduction while it's in motion. Notice that the table is totally enclosed, both the base for security around the motor and also your mechanism which powers the cobble section of the table up and down. This eliminates any children or anybody's hands getting caught into the mechanism. To get a patient on the table, put the selector switch in the off position, start the table at a slow speed, and stop it in the flex position. Drop out the thoracic cushion so the abdominal section drops down, and then have the patient kneel onto the cobble section of the table and fall forward. There's a handlebar that they can grab onto and adjust. You want to lock the patient into the ankle straps. And pull out on the ankle rest to create a little bit of distraction. We can start the patient in motion and turn up the speed. During this motion, you can create a counter pressure on the patient. You can also insert your tiller bar unlock the coddle section and go through lateral motion, circumduction, or you could lock them in any position and have the table work at that position. When you stop the table, keep it in the off horizontal position, which means that when you hit the stop button, you can stop it in the flex position. And the patient then can either push up and exit off the table.